Hi, it's Michelle, and I'm going to lecture on heart failure. First, heart failure. Let's talk about the causes. All right, causes for heart failure. It can be a complication that can result from problems such as cardiomyopathy, endocarditis, valvular heart disease, acute MI, or hypertension. Hypertension is the leading cause of heart failure. So let's talk about different types first. First is left-sided heart failure. Left-sided heart failure is when the left side of the heart is not moving blood forward into the aorta and out to the body, so it begins to back up where? In the lungs. Okay, it's going to go backwards into the lungs. So let's talk about that just a little bit more. So when you have a patient who has left-sided heart failure, okay, the left side of the heart is now beginning to fail, and the blood is not adequately moving forward in the direction that we'd like it to go. If it's not moving forward into the aorta, the first and largest artery in the arterial system, it's going to go backward into the what? Into the lungs. So look at those signs and symptoms in your book. They look really, really pulmonary, don't they? Okay, so I want you to write down left equals lungs. Left equals lungs. Let's talk about right-sided heart failure now. So right-sided heart failure, if the blood is not moving forward into the lungs, it's going to move backward into the what? Into the venous system. Into the venous system. So let's talk about that just a little bit more. So the right side of the heart is sick, and it's not moving the blood in which direction? Forward. Okay, so if it's not going forward, it's going to go backward into the venous system, back into the body. So you're going to see things like distended neck veins, edema, enlarged organs, all of those things. On your handout, you're going to see words that say different types of heart failure, like systolic heart failure. Systolic heart failure is when your heart is not able to contract and eject the blood. And next would be diastolic heart failure. That's when your heart can't relax and fill. That's new terminology for heart failure you might see on NCLEX. Next, we're going to look at how we diagnose heart failure. On your handout, you have the very first thing is B-type natriuretic peptide. And what it is it's a blood test. And BNP is secreted by the ventricular tissue when the ventricular volumes and the pressure in the heart are increased. It is a very sensitive indicator, and it can be positive for heart failure if your chest x-ray doesn't show a problem. Okay, so it can be positive for heart failure if your chest x-rays do not indicate a problem. If your client is on nasiratide, I know you see that it says Natracor right next to it, okay? You're going to turn that off 2 hours prior to the draw, okay? Before we draw a BNP, we're going to turn that off 2 hours before that. Otherwise, it's going to give you a false high. Next, we have, we're going to also do a chest x-ray, all right? We're going to do a chest x-ray, and what we're looking for is an enlarged heart, and we're looking for pulmonary infiltrates. We're looking for fluid, okay? We're looking for edema. And your patient's also going to have an echocardiogram, all right? An echocardiogram, and that looks at the pumping action of the heart muscle. And also you're going to see on your handout the New York Heart Association functional classification of clients who have heart failure, okay? CHF. And it says classes 1 to 4. What I want you to know is class 4 is the worst. You are a brand new nurse with 2 weeks of vast nursing knowledge. I don't think they're going to ask you to classify heart failure, but what they might do is give you some information about your client in heart failure, and so you'll know about their functional ability and ability to take care of their ADLs, okay? And also on your handout, you're going to see a Swan's-Ganz line and an A-line catheter, okay? And what that's going to tell you is your patient's in heart failure, and I want you to study that with heart failure, okay, when you're getting ready for boards. Next is treatment for heart failure. Let's talk about medication first. First, we have ACE inhibitors. We have ACE inhibitors in ARBs, but first, the first line is the drug of choice is an ACE inhibitor for heart failure, all right? And what they do is they suppress the renin-angiotensin system, they suppress the renin-angiotensin system, and they prevent the conversion of angiotensin 1 into angiotensin 2. And this results in arterial dilation. Okay, it results in arterial dilation and increased stroke volume. Increased stroke volume. And isn't that what we want with our heart failure patient, is increased stroke volume? Now ARBs, what they do is they block the effect of the angiotensin II receptors, and they cause a decrease in your arterial resistance and decrease blood pressure. And I'm going to tell you, they might be used first instead of an ACE inhibitor, because what does that ACE inhibitor do to your patient that is really aggravating? A dry, nagging cough. That's right. Okay, bye for now.